Sometimes people are like, why libraries? There's over 17,000 libraries nationwide. We know in our rural areas, there aren't as many providers. There aren't as many hospitals. There's not as many clinics. But libraries are everywhere, and they're welcome to everyone in the community. And a lot of folks are already going there for health information. The idea is to have a health liaison, someone based within a library, able to help provide support and connection to medical care, health care, and also, again, those supportive social needs like food, housing, insurance, getting people connected to all those things that drive health as well. We were quite open to how it could look in each community. We know that everybody knows what will work for them, but what we did ask for was a library and a library system being central and a major partner in it, having a health liaison, so a social worker, a health educator, a community health worker, really open in those areas, and then also a healthcare partner. And that's really how the program got started.
So our initial planning around libraries and health began in early 2020. By October 1st, 2020, we had awarded and were onboarding 5 new libraries in the state.
But then we were able to expand to 4 additional communities through a partnership with the South Carolina Department of Health and Environmental Control that saw the value of the work. So now there are currently 9 library systems in the program.
Every community is unique and different. So for Kershaw County specifically, it's really just been the basic necessities of housing, hygiene items, furniture, food, stuff like that.
Transportation is an issue. Like, I know there's some patrons who might walk a mile up the road just to get to the library. So we aim to do telehealth visits with MUSC, which is located in downtown Charleston. And that way someone could come into the library and get set up on the computer and talk to their doctor that way.
So we have a lot of food insecurity, and they are just combating obesity, diabetes, hypertension. So we've tried to make some ways that they could get healthy food, and we've supported that by teaching, having cooking classes so we can teach them how to prepare the food properly.
These services are actually what I do as a community health worker. So we offer blood pressure checks, we offer glucose checks, we do mental health referrals, we do dental referrals, we assist with medication, we do SNAP applications, we do Medicaid applications, we do diabetes education, mammogram scheduling, colonoscopy referrals, we do prenatal counseling.
I really love the partnerships that we've been able to build along the way with this program. We recently started a partnership with the American Heart Association to provide blood pressure cuffs to our patrons that are actually circulating so they can check them out with their library card and take them home. And RIN is able to provide them assistance and show them how they work and talk them through some questions that they might have and get them referrals.
We have a strong partnership with law enforcement. They're housed here in the library. We have a strong partnership with them. And through that, we've learned that mental health was an issue.
With mental health being one of the disparities in our community, especially in a rural setting, I came across this news article for Originating, which is a center in the Columbia area, not far from here. They had a new grant where they were paying for individuals to become instructors for mental health first aid. I became an instructor, and we've trained so far over 100 people in our county on mental health first aid.
We wanted to offer something tangible to our residents that were already facing food insecurity here in Bishopville. And we're also partnering with local farmers and Mount Calvary Missionary Baptist Church, which is here today. They have a myriad of food ministries that they offer to the public.
We have started with accepting donations from our patrons and other community organizations to keep in-house. So things like non-perishable foods and the hygiene kits.
So our strength is that we can make things that are complicated understandable. We can make someone know how to maneuver through these different systems and these different agencies and point them in the right direction.
For a long time in Orangeburg, trust was an issue and still is an issue, especially when it comes to healthcare in the community. And I truly think that it's changing, especially with projects like this, where the hospital is joining in on the library, because the library is a happy place. We're meeting you where you are. We're stepping outside of the hospital, coming into the library.
Farmers market being on site is a big deal because it eliminates several barriers for people getting healthy food. We can meet that demand right now if they need to come inside and need food right away.
Lowering their A1C and their blood pressure is something big here.
I've seen people come in to get referrals to find out information of health problems that they may be having, or I've seen the homeless come in and get assistance where they were getting food being served to them. We've also had people to come in who had maybe hit hardships because of COVID, lost their homes or lost things that they had. We were able to help them by making referrals to other community services here.
Every time I introduce myself as the library social worker, everybody's kind of amazed at the idea of it. I think it has broadened the minds of our community as far as what a library can do, where there are so many organizations who are readily available to help. And we have utilized the library as a community hub to bring all of those organizations together, to have me as a resource navigator connecting patrons and community members to the most appropriate resource for them. So we have a resource room that has flyers and upcoming events and other services that might be of interest to our patrons. That's also where I meet with each patron of mine, and we do a little mini assessment to figure out what they really need. It gives a nice private space for us to talk about some very sensitive things.
So we have specific medical providers at MUSC that we work with for that service. So if someone comes into the library and they're interested in an appointment, we'll find out, what it is that they're wanting to be seen for. And then we'll reach out to MUSC and get that appointment scheduled for them. And if the patron wants to come back to the library to do their visit, they can do that here. We have a designated laptop just for telehealth.
I certainly built relationships with my patrons, and I'm really proud of the different collaborations and partnerships I've been able to bring here to the library. It's just agencies coming together and working together.
They're not intimidated or as timid with this type of program. They got a friendly face that really cares about them. We would never see some of the people that are in most need of services if we didn't have programs like this.
This project has been very impactful, and it's touched many lives in the community. It is very important that we have provided a community shoulder to lean on to help people get the services that they need, and seeing that and then them coming back and telling us, hey, I was able to get into a house. I was able to get my baby into school because of the services that have gotten here.
So as we get people connected and as those relationships are built, and the social worker or the community health worker is able to connect someone, say, to a food box program or to housing assistance, that opens up the conversation for, the thing, oh, well, I have this going on, or, my doctor said I had diabetes, or I'm worried about this. Do you have any other information? And also, as we're moving more towards, value-based care and more health systems and healthcare providers, the conversation nationally really is around meeting those supportive social needs so that people can have a higher quality of life. And libraries being a place, again, where people already are going, you can establish that trusting relationship versus just expecting someone to come to the clinic.
Having a library social worker program and having social work as a part of the library brings to light something that's always been there, which is that libraries are havens for people from all walks of life. We're welcoming, and a lot of our patrons aren't necessarily coming here for books or to be exposed to literature or culture. They need very fundamental things. They need housing, they need food, they need dental care, they need connection to healthcare and insurance. So to me, social work and librarians are perfect matches.